Hello and welcome to Ask the Specialists on CMU Public Television. Tonight we're talking to the veterinarians. Your questions next. Hello and welcome again to Ask the Specialists on CMU Public Television. I'm Mike Horace, and tonight we're talking to the veterinarians. Let's meet our guests. First, we have Dr. Martha Grant. She's with Mount Pleasant Animal Hospital. Dr. Grant, welcome.
Hi, good evening.
And next to her, Dr. Alex Imlay with Animal Health Associates. Dr. Imlay, welcome.
Good evening, nice to be here.
Just to begin, could you each talk a little bit about your practice, what you specialize in? Tell us a little bit about yourself.
I work at Mount Pleasant Animal Hospital, like you said. We work on dogs and cats only. Occasionally we'll have something else come through the door, but mostly dogs and cats. I started working there in 1998 as a kennel assistant, and I've been there as a veterinarian for 6 years now.
Dr. Imlay.
Well, I grew up on a small farm in Ingham County, fell in love with the veterinary practice, and was lucky enough to start a practice here in 1989. And we do all of God's creatures. We dogs, cats, horses, gerbils, everything you can think of, and it's a lot of fun. Every day is a great time.
Well, our doctors are here to answer your questions tonight. There's a couple ways to get a question to us. The first, maybe the easiest way, give us a call, 1-800-727-9268. You can also head to our Facebook page, facebook.com/askthespecialists, or send us a tweet using the hashtag #AskThe. All right, let's get to our first question, and this one coming from Mount Pleasant this evening. This caller has a 14-year-old lab who has hindquarters that are losing their strength. They're having some issue with losing their bowels as well. Wondering if you have any suggestions on that front.
Well, first, they should definitely make contact with a local veterinarian. There could be a lot of problems from arthritis, the degenerative spinal condition, so they need to have a workup. There's probably nothing we can suggest at home without being looked at by a veterinarian.
A lot of times people will hold off thinking that there's nothing that can be done, but there are a lot of really good medications and things like that we can have to manage symptoms in older pets also. So definitely worth getting them checked out.
All right. We have a question that came to Facebook before the show. This one from a younger viewer wondering, when I grow up, I want to be a veterinarian, and they were wondering, what is your favorite story, your best story as a vet?
Favorite story? Well, the best ones are when a pet comes in that's sick or injured and the owners are really worried beside themselves, and you can get them fixed up and get them home and healthy. I had one several years ago. It was a tiny little kitten that the owner rushed in and said she was choking. And she actually was choking on a piece of pork chop, and she was unconscious, and I was able to do CPR, and I saw that same cat again a couple years later, full grown and healthy and doing well. So those are the best ones, when they can go home healthy.
And I also had kind of a miracle case where a grandpa backed over his grandson's puppy dog and actually broke his back. And we were able to stabilize the vertebrae with some pins, and when we woke the dog up from anesthesia, it was able to wag its tail and it walked away. So it was like one of those miracle cures, so it was a lot of fun.
All right, this question coming in from Gaylord this evening. The caller has a 7-year-old boxer who's getting some scabs on their back, and they're losing their hair where those scabs are appearing. They're wondering, what might that be?
Well, I guess the first thing you should check into is to see if there might be fleas. Flea dermatitis or flea algae dermatitis is a very common cause of alopecia and scabbing on the back. There are other types of allergies as well, but checking out with the veterinarian, running a flea comb over the back, maybe looking at the hair follicles can give you a good indication of what might be happening.
All right. On the topic of fleas, a caller from Charlevoix wondering, what is the best way to get rid of fleas from a dog?
The best way is, and you have to basically have a long-term treatment plan. If you have fleas on the pet, that means they're in the house. There's way more eggs and larvae than there are adult fleas that you're seeing. So there are a lot of good products on the market. Then generally we recommend treating all pets in the house with a monthly flea prevention for at least 3 consecutive months. And that's the only way. If you just do 1 month, then the eggs and larvae are going to grow up and you're going to have a continuous problem. So there are a lot of good topical products. Each veterinarian has ones that they prefer, but the monthly products are the way to go. The bombs and things like that aren't going to fully get rid of the problem.
All right, a caller from Lincoln Park says they have a cat who pulls on the pad of their feet when they're grooming a lot of times. They're wondering, is there a reason the cat is doing this?
Well, if they're not doing any damage, it's not necessarily a problem. Sometimes if there's something stuck in the fur, maybe they'll chew on that. Or if there's some inflammation and the paws are itchy, that might be another reason that they're chewing or licking on the paws.
Okay. A caller from Afton has a 10-year-old cat who has dark drainage around the eyes. They're wondering what can they do about that problem?
Well, number one, they probably should be seen by a veterinarian where they would do a thorough physical exam, evaluate the eyes. It could be simple conjunctivitis, or there could be something more serious. With conjunctivitis, it's pretty easy to treat with topical ophthalmic ointments, but they should see a veterinarian and make sure there's nothing real serious.
All right, a reminder, you can join the conversation this evening by giving us a call, 1-800-727-9268. Our next call from Buckley, and this is a horse question. They're wondering if it's okay to leave their horse out in the paddock in this cold weather, and is there something you would recommend to protect the hooves in the cold weather?
Well, I guess you need to use common sense. When it's 10 below, they need protection from the wind and the elements. But horses that are used to it, their coat is thick, and they really don't need anything special to protect the feet. But when it's really severe, they need to be able to get out of the wind and have some type of shelter.
All right, this call coming from Manistee involving a 10-year-old golden retriever. An issue happening about once a month, the dog will gulp, making a noise almost like it wants to vomit, and something like it's caught at something in the throat. Wondering what could cause that. Is there something they can do to help the dog out?
Well, first they should definitely have their veterinarian take a look. Rarely there are things stuck in the throat that may be causing them to do that. It may be an inflammatory process in the mouth or farther back in the esophagus. So, there could be a lot of things. They might, at 10 years old, they probably should have some blood work and other thorough checkup things done by their veterinarian to see what might be causing that.
All right, this call coming from Higgins Lake, wondering if there's anything you can do to clean the wax out of a dog's ears. What is the best method to use?
Well, there are actually products available which help break up the wax. And depending on the severity of the condition, sometimes they need to be cleaned as often as once a week. Increased wax production is often related to an allergy condition, and so they should actually be seen by a veterinarian to make sure that isn't a problem.
All right, this call coming from Manton. The caller has a Pomeranian who is chewing at his leg, and it's making the leg turn kind of raw. They're wondering what could be causing that. What is a possible solution as well?
There are several things that could cause a dog to chew at their leg, depending where on the leg it is. If it's near a joint, sometimes they have arthritis that's causing them to do that. It might be anxiety related. Some dogs will chew or lick on their front legs if they have anxiety, or it could be allergy related. We've talked a little bit about flea allergy, or it could be an environmental allergen or possibly a food allergy that could cause them to lick. So several different options that they might need to have their vet examined to narrow down the possible cause, but each one has its own treatments, so there definitely is worth getting them checked out.
All right, the next question coming from Facebook this evening. They're wondering, how often should you get a dog's teeth professionally cleaned?
It's probably, once they're mature, it's kind of an as-needed basis. If they're willing to brush their teeth and manage it that way, it's often delayed greatly. Some of our smaller breeds dogs, we almost need to clean them every year, sometimes a little more often than that. If they have tartar and plaque and their gums are inflamed, they need it sooner than later, but probably no more often than once a year, and just depending on the condition of the mouth.
All right, the next question from Pearson, Michigan. This caller has a 7-month-old male who has started, he was neutered, after surgery started urinating on the caller's daughter's clothing. Wondering if this could be a medical problem or is it more of a behavioral issue? And the question doesn't say if it's a dog or cat here, so I'm not sure which one we're going after.
It's hard to say. The more likely culprit, I would say, is a cat that's neutering on the or
Yes, a
urinating
cat.
on the clothing. Oftentimes it is behavioral, but there are some medical causes, and a young cat like that, I would suspect it's a behavioral cause. But it should probably be checked out by their veterinarian just to make sure there isn't a problem, urinary tract infection, and so forth, and before they start discussing different behavioral treatment options for that.
All right, the next question coming from Plymouth, and this caller has a new dog in the house with a cat that has been in the house for a while. There's a little bit of tension between the two. Do you have some advice on how to make the animals get along?
Well, I guess you just have to be patient. I guess there's a couple different ways. You know, you could control the dog. If it's a small dog, you can keep it in the carrier and allow the cat to get used to the dog. More times than not, the dog will chase the cat, so you're going to have to use obedience training to keep the dog from chasing the cat. So it's a matter of adjusting, getting used to each other. They may never get along. Cats kind of not necessarily like new strangers in their house, so they may work hard and they just don't like each other.
But it sounds like time is really...
Time and patience.
Try to make sure the cat has an escape route where it can get away from the dog.
All right, a caller from Beaverton has a female lab who's been spayed and is getting some right ear irritation. They have wipes from Petco that they use about once a week, but they're wondering if there's anything else they can do to help reduce that irritation.
Well, they should probably have it checked out by a vet. We've talked a little bit about ear cleaning and such. There are different types of infections, yeast and bacterial infections that dogs can get in the ears, and it may need a little more aggressive treatment than just an over-the-counter cleaner. So definitely worth getting checked out. Ear infections are often caused by allergies, so that will take some investigating also, and they can work closely with their veterinarian to get to the bottom of it.
Most veterinarians will take a swab of a sample and put it on the slide, and they can actually look and see what kind of bacteria or what kind of yeast that are present, and then they can formulate a proper treatment protocol for it.
All right. Our next question coming from Facebook, and this person is wondering if you have any viable treatments for egg-bound chickens.
I guess I would suggest they call the extension office, in their county. They would probably have a resource for that. I apologize, I do not know a lot about chickens.
All right. A call from Rudyard this evening. A 7-year-old cat has excessive dandruff. They're just wondering if there's a way to help get rid of it.
Well, if it's just dandruff or dry skin, sometimes that with the changes in heating in the house and things can cause more dry skin at different seasons of the year. But one thing they want to make sure to get closely examined is the skin itself to see if it is inflamed or if there might be a different problem going on. Sometimes if cats aren't grooming themselves very well, their hair will get matted, and that can cause some dandruff areas also. So probably would have to get it checked out by the vet to make sure there isn't anything else going on. Cats aren't usually too thrilled about any kind of shampoos or anything like that. So they should get to the bottom of it with their veterinarian.
All right, this caller from Edmore, they have a 6-year-old border collie who apparently has stopped drinking water and only wants to eat snow. Why is he doing this?
Well, I imagine he probably is drinking some water. Dogs like snow. They like to play out in the snow, and it's just a fetish. I don't think there's any health reasons. If he's truly not drinking any water, they really should have him checked out because that could be an indication of some kidney issues as that go. But I bet he's just enjoying the outside and loves the snow.
All right, we've got a caller from Ann Arbor who has a 13-year-old French bulldog who is getting skinny, and their veterinarian has said that the kidneys may have damage, and she's still eating and drinking. The blood work and x-rays have been done at a hip vet, apparently, and the vet is saying that it might be time to start putting down the dog. They're wondering if there's a way to get a second opinion, if there are some things that can help a dog who is in their older age who might be starting to have kidney problems.
Well, kidney problems, generally the first step in diagnosing those is the blood work. So Most veterinarians would definitely be willing to give a second opinion on their pet, and oftentimes you can take the records that were done at the first vet and they can review those and see if they'd like to do additional tests or anything. A lot of older dogs and cats will develop kidney issues, and they can be managed quite well with special diet is the mainstay of the treatment for the kidneys. But with regular blood work checks and diet and sometimes other medications that we add to control the phosphorus and other things, they can be managed for quite some time.
All right, this caller from Prudenville has a 3-year-old male cat who is biting his tail and chasing his tail a lot. They're wondering what to do about that since they're starting to cause some issues with biting the tail.
Well, I guess I would, again, have the skin of the tail and the back of around the tail head evaluated to make sure there's not some physical problem. You know, there's not irritation of the skin, which we'd call dermatitis. A lot of cats just like to play. Usually they don't mutilate themselves. So if he's actually doing that, then he really needs to be seen and try to figure out what is going on in the tail. Maybe there was trauma done to the end and there's some decrease in blood flow. So he really needs to be seen by a vet if he's doing that much damage to his tissue.
All right, another question from Facebook now. Is there a way to get your dog to stop eating feces out in the backyard?
Well, I believe Dr. Imlay has been dealing with this, so I'll let him take this one.
There actually is a product you can get from your veterinarian that you add into their diet. It makes the feces taste bitter or worse than normal, and it really works quite well. The only thing you have to realize is that if you have multiple pets, they all need to have it in their diet, and they usually do it for 3 to 5 days, and the taste is so horrible that they stop. Probably the best way is beef clean. You know, clean everything up you can. You know, the frozen snow, get it out of the way so he doesn't have an opportunity to do that. So.
All right, their next question coming from Higgins Lake. This caller has a 5-year-old Dachshund Beagle mix who breaks out when they roll around in the grass. Sounds like an allergy issue. Do you have some advice to maybe stop them from breaking out?
Well, it definitely could be an allergy or a contact irritation to the skin. If it's a certain place in their yard where the dog is rolling, I'd want to know if their yard was being treated with any certain products, because that might be the culprit instead of the grass itself. But if it is a contact irritant that's causing it and the dog keeps doing the same thing, it's going to be hard to get that to stop. There are some treatments for allergies, outdoor allergies, medications that can help their immune system, and also allergy injections, just like people get. Those are available for pets also if there's something in their environment that you cannot avoid.
And then that same caller is wondering if there are some over-the-counter drugs for people that should be avoided for dogs. Are there some that you can use with your dogs?
There's actually, really should be really, really careful, and you probably should not self-medicate your pets. Advil, Motrin, things like that can be really, really dangerous, and we often get questions of people that give those things to their pets, and I just really think self-medicating is a bad thing to do. You need to visit with your veterinarian, and they can make suggestions if there's any, human meds that they would say is okay, and there's usually such a huge size difference too. We see patients all the time that accidentally eat their parents' drugs and get really, really sick, so they need to be really, really careful with that.
All right, this call coming from the Upper Peninsula, a poodle who has had his front leg amputated. They're worried about his other front leg now. What are the chances of him breaking it or damaging it somehow if he, for example, jumps off the bed?
Well, unless there is a different issue dealing with bone density or reason that the dog would have weak bones, it shouldn't be a real concern. One thing that they would want to do is make sure the dog is not overweight, because any excess weight that dog is carrying is just going to put stress on the joints and the remaining leg. So I would be real cautious to not overfeed and make sure that he's getting enough exercise and the muscles and joints stay strong in the remaining leg.
Three-legged small animals do amazing. We both have pets at home that live just wonderful lives. So if some crisis happens, don't be afraid of that procedure, because they live a wonderful life and really don't have many problems if they're allowed to be exercised well.
All right, another Facebook question now. What is the best way to calm down a dog's separation anxiety?
Separation anxiety can be very frustrating for a lot of owners, and each case is different. If there is a behaviorist in their area, it would be good to consult with them because a lot of the treatment for separation anxiety involves behavior modification, such as not making a big deal about when you're leaving or when you're coming home. You want to be very calm around the pet. Oftentimes a crate is used when you're gone so that they're safe and they're confined. And dogs tend to see crate as a sort of a den, safe area. There also are medications that can help with the anxiety and the calming supplements and things like that. So generally it's a combination of veterinarians and behaviorists working together for dogs with very severe separation anxiety. There are also, there's a product called a Thunder shirt that a lot of patients have used, and their owners have liked the results in that. And it's basically a shirt that holds the dog's chest closely, and so they feel comforted with that around them.
The most important thing to remember is when you're selecting a pet, think about what that pet's used for. If it's a border collie that's out running and playing, it shouldn't be in an apartment. And that's what happens. We don't think about what they normally should be used for. Dogs with high energy labs, they need to be out playing in a big yard, and they just can't handle the clothes, and they kind of go mentally crazy when they can't go out and play and do their thing. So think about what kind of lifestyle you have, and there's lots of pets that would fit. Maybe a lab wouldn't fit for someone who lives in an apartment, and that way you prevent that from happening.
All right. This call coming from Imlay City, and they're wondering if there's a way to tell if your dog has ear mites.
Well, the easiest way is actually take a sample, and what we do is we take a swab of the debris, we look at it under a microscope, and it's really kind of creepy. You can see the ear mites crawling, and you can see eggs. The eggs are, so it's real easy to identify. Usually adult dogs don't get ear mites unless they've been in a kennel, because contact is the way it's spread from dog to dog. We see a lot in cats, lots in kittens, not in cats, but a lot in kittens, but it's pretty easy to diagnose.
All right, this caller from Benzie has an 18-year-old cat who recently lost one of his cat friends, and he's been crying continuously ever since. They're wondering if there's anything they can do to help their cat out.
It's tough if they've been with the other pet, especially 18 years. That's a long time for them to be together. Providing comforting things for the cat, giving it lots of attention. And also, I would check to make sure a cat that age doesn't have something else going on, and having an exam and possibly some blood work and tests done to make sure the cat's healthy and it's not crying for some other reason, that it's sick, possibly.
All right, this call from Harrison. They have a 6-year-old, 70-pound lab mix who had surgery on his ACL. Now he has a torn meniscus on one leg, and they're wondering if there's anything they can do to help manage pain besides some of the pain meds that he's currently on.
Well, common sense things, you need to restrain him so he isn't jumping, playing, torquing that knee. You can certainly, if it's an acute process, local therapy, ice packs, things like that will help some, but probably nothing that's going to help a lot other than the pain meds and then having surgery done. They really need to have surgery to fix that meniscus, actually remove the meniscus.
All right, this call coming from Beaverton. They have a cat who vomits every 3 days. He's a 6-year-old long hair, and they do not give him hairball medication. They're wondering what might be causing the vomiting. What can they do to maybe prevent it?
Long-haired cats, they definitely can have problems with hairballs, but really a cat with any length hair can have an inflammatory condition that can cause vomiting or diarrhea. So there are several things that could be going on. Definitely worth getting it checked out every 3 days is something I would be concerned about and have them examined by their veterinarian to see. But some cats need to be on a special diet if that's a problem, or some need to be on hairball medication to prevent that and help things move through more smoothly.
Okay. Caller from Remus. They have a 16-year-old cat who is losing some hair on the back half of their body. They're wondering, could this be a hot spot, and how can you prevent such things?
Well, again, this time of year, you wouldn't think it, but we do see a lot of flea infestations, and it could be related to fleas, especially in the back third of the body. That's pretty common. Cats don't generally get hot spots like dogs, so it's probably an allergy of some sort. It could be a hormonal issue as well. They should really have it checked out by their veterinarian.
All right, a caller from Oscoda has a 4-year-old cat who on occasion will fly across country, and they want to know if there's a natural sedative they can use before taking a flight.
I'm not familiar with any, natural sedatives that they could use. I'm always very cautious of wanting to prescribe any kind of sedation for an animal going on a flight, just because if they were to have an adverse reaction, there's no one there who can help them. They're not anywhere where they could get the cat or dog to a veterinarian. So generally, I don't recommend that for flying. If they're flying with the owner and they're used to it, some cats will do fine if they can be in the cabin with them. If they're not used to it, I usually have people do some trial runs with car rides and things like that, get them used to carriers before they would try to take them on an airplane.
All right, and one last question, this one coming from Petoskey, a very timely one given the cold weather we've been experiencing. How long is a safe amount of time to be out in the cold for a dog? In this particular case, it's a mixed breed, an Aussie mix.
Well, I take regular walks with my dogs, and we'll be out for at least an hour, hour and a half doing things. I think if the dog's used to it, if it's 20 below, probably not very long, enough to go, and the dog will kind of let you know. But, if a dog's used to it, you can take walks. If they're active, they have a nice hair coat, it's, they can do what we can do. If we're really if our cheeks are turning white from frostbite, then they probably shouldn't be out either.
Sounds like common sense.
Common sense is the key.
Generally, their paws tend to get cold first. If you notice them holding their feet up, things like that, you might want to consider boots and things to keep their feet dry, keep the ice from getting in between the pads on their feet.
All right, well, that is all the time we have for this edition of Ask the Specialist. I'd like to thank our guests, Dr. Martha Grant with the Mount Pleasant Animal Hospital and Dr. Alex Imlay from Animal Health Associates. Thank you both.
Thank you.
Thank you to you as well for watching tonight. Be sure to join us next week for Ask the Senior Care Specialists. Thanks to our producer, Stephanie Mills, our director, Matt Ozanek. I'm Mike Horace. For everybody at CMU Public Broadcasting, have a good evening, and we'll see you next time.